Hello everybody and welcome back to What the Health with Dr. L, where I share with you brief evidence-based answers to important health and wellness questions. And today's question is what can I do naturally to help lower my blood pressure? Just keep in mind that these recommendations I'm going to share with you today are backed up by clinical research, so they are treatment. They are not just something nice to do. So if you have been diagnosed with high blood pressure, taking medications, following these recommendations will help you significantly, more than any medications you're taking. And because the best medications or medication combination contribute to 30% of lowering your blood pressure. Lifestyle modifications count for up to 70%. And if you're not taking medications, these things will definitely help you avoid ending up with high blood pressure, especially if you have a strong family history. The first recommendation is diet, paying attention to what we eat. So what we eat should be food that helps keep our blood pressure down. We refer to this as DASH diet or dietary. The DASH diet is dietary approaches to stopping hypertension. And the diet that is recommended, it looks very similar to the Mediterranean diet, however with much less salt intake or sodium intake. So it's high in, it's a well-balanced diet that has fresh fruits, vegetables. It uses fish and seafood 3 times a week as a source for protein. Also uses legumes, uses olive oil and lemon or lemon juice for dressings. It also includes garlic and aromatic herbs, and it limits the red meat intake to a couple of times a week. If you're gonna use red meat, it's highly recommended that you use grass-fed organic meat. Also, it's high in potassium because most people lack potassium. Average American usually gets 22 milligrams of potassium a day. We need to shoot for 35 up to 5,000 milligrams of potassium a day. And a good source for potassium would be sweet potatoes, avocado, bananas, and different vegetables and fruits as well. The only exception to potassium is people with chronic kidney diseases, because these people tend to hold on to potassium a little bit longer. So people with kidney problems, they need to follow a renal diet, and they need to just go by whatever their kidney doctor recommends for them. The other thing is activity. Some people do not like to use the word exercise, but basically you need to find ways to increase your activity output. You need to find a way to walk 3 times a week, for instance. 150 minutes of brisk or fast walking is good. It helps to lower your blood pressure. And also light strength training. If you don't like weights, you can use rubber band. Just get a rubber band and do 3 sets of 10 repetitions for your arms and legs. On the days you don't do the brisk walking, 2 to 3 times a week. Also, which is very interesting, isometric exercise. Isometric refers to contracting your muscles and holding the contraction in place for 10 seconds or so. So there's an Australian study that shows that people who do that, like squeeze their hands and hold it for up to 10 seconds 3 times a day, that helps to lower blood pressure by up to 7 points. Another way of doing isometrics is plank exercises or wall sit. Like, if there's a wall behind you, you put your back against the wall and you sit down for 10 seconds. You do this 3 times a day. That will also help to lower down your blood pressure. The third recommendation is you need to find a way to de-stress, to channel your stress. And of course there are studies to back this up, that meditation helps to lower blood pressure, but meditation comes in many forms. To me, if you sit down and do some structured deep breathing for 5 minutes. That's a form of meditation, like this. Or centered prayers. You repeat a word that helps to calm you down, like peace or love. A few minutes. That's a form of meditation. Like you pick up a word like peace, 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 peace. For a few minutes. That is a form of meditation. Also, enjoying nature and pondering over the beauty of nature is a form of meditation. The third recommendation is finding a way to get enough sleep, not less than 6 hours of quality sleep. And if you're taking diuretics, you need to take your diuretics early on during the day to avoid having to get up at night to go to the bathroom. Quality sleep is very, very important, to keep your blood pressure checked. And for those who drink alcohol, they need to limit their drinks to 2 drinks if you are a man, and only 1 drink if you are a woman. I personally do not drink, but those who drink, they really need to be aware that alcohol also raises your blood pressure. And I'm gonna leave you with this idea that if you do these things, these simple things, start somewhere, you can bring your blood pressure down up to 15 points, 15 milliliter mercury systolic blood pressure. If you do a combination of these things, that is much better than any drug you might be taking. And we all know the side effects of drugs, feeling tired, feeling dizzy, sexual dysfunctions, and some people end up with swelling and other issues as well. Start somewhere. These are easy things to incorporate into your daily routine. I wish everybody well. Take care of yourselves, and all the best.